All right, whenever you're ready.
Okay. So we all share the common experience of being born. Of course, none of us remember this, but I guarantee you that at least one of your parents remembers, because it is a momentous occasion, life-changing, that you'll never forget, something you'll remember throughout your entire life. And many of you in the not-too-distant future will become parents. And this leads me to the question of what kind of birthing experience do you want for your family? How do you want to bring your child into the world, and what do you want that to look like and feel like? And do we even have a choice? There are many pregnancies that are high-risk pregnancies that require a high rate of medical intervention to bring the baby to term and to deliver the baby healthily. And for that, the hospitals are great. We need that there. But according to the University of California at San Francisco, only 6 to 8% of pregnancies are high risk. That means 90% of all pregnancies are healthy, low-risk pregnancies. And should these kinds of pregnancies be subject to the same kinds of highly medically intervened strategies that are used with high-risk pregnancies? So what I would like to present to you today is I'd like to emphasize that the normal mode of approaching pregnancy in the United States has become a highly medicalized one, and that this is just the normal way we do things, excuse me, a highly medicalized approach for low-risk pregnancies. So we highly underuse certain strategies that are more natural, that are more beneficial to the environment and to the process of childbirth. And I'd like to point out that midwives actually provide an excellent standard of care as healthy, low-risk pregnancies can use. So I'd like to begin by pointing out the prevalence of medical intervention as it pertains particularly to labor induction and cesarean sections. And then I'd like to compare it to natural approaches and what those differences are. So let's begin with the rates of labor induction. So labor induction, there are about 22% of births in the United States are started by artificial means. This means they usually start with a drug called Pitocin. And with Pitocin, let's see, Dr. Luann Benzadine describes Pitocin as a drug that artificially starts labor by artificially causing the uterus to contract. And when this occurs, when we have a natural birth, the brain releases oxytocin, which is a hormone that kind of balances a woman's body and brain out to prepare for labor, to deal with the intensity, and to kind of stick with it. And when Pitocin is administered, this beneficial hormone gets cut out of the picture. So you don't have that regulating effect that you do with a natural childbirth. Also, with Pitocin, when it's started, a woman is started on the IV, and there's also fetal monitoring that goes on. So the Pitocin makes the uterus contract extra hard, harder than a normal process of delivery. So they have to monitor the baby's heart rate to make sure the baby is okay. So with an IV drip and a monitor on, this means a woman is in her bed and she's not really allowed to get out of the bed. But time-tested strategies have proven that a woman needs to move, she needs to walk, she needs to shimmy to help get the baby in position, to help open up the pelvis and create an environment that is more conducive to giving birth rather than sitting in a bed. And because the contractions get stronger with the Pitocin and you're lying in the bed, labor becomes much more painful, which leads to higher rates of anesthesia like epidurals and other narcotics that help cut the edge off. But that edge might not have been there with quite the same intensity if the drug was never started in the first place. So oftentimes this can lead to Caesarean section because the baby will be in distress and there's a kind of an emergency situation that arises. One obstetrician nurse in a New York hospital was interviewed for the film The Business of Being Born, and she claims that over 90% of patients that come in for birth there is medical intervention that takes place. And she states that if that patient is not making the kinds of changes specifically that they need within a specific period of time, then they will intervene in that labor and delivery. And so this goes to prove that they need things to fit into a certain box and a certain mold. And it's time-tested strategies that these things take time. They take a relaxing environment. It can't be rushed. Sometimes when a birth is rushed, things close back up and you kind of have to go back to square one. So the kinds of strategies that are used for low-risk pregnancies in hospitals kind of interfere with the body's natural progression of labor. So I'd now like to move into the rates of cesarean section in our country. So the World Health Organization claims that a good healthy cesarean rate for a nation is 15%. And as of 2005, the United States has a C-section rate of 30%. That's double what it should be. And that is nearly 1 in every 3 pregnancies are being delivered through surgery, an invasive surgery that cuts through the core muscles of the body, that takes a lot of healing time, and it takes pain medication to get through, which can interfere with the bonding of your baby and integration of your family. And 1 in 3 is a really high number. I'd like to compare this to Ina May Gaskin, one of the pioneer midwives in current midwifery. She has been delivering births for well over 30 decades. And she started counting, like at one point, did they need a cesarean birth? And it was at birth 187 that they needed to deliver a baby safely by cesarean. Now let's contrast that with 1 in 3. Wow. And then the second one was needed at birth 324. So I think we're relying really quite too heavily upon these medical interventions, and it's not necessarily to deliver the baby out of safety. I mean, it's proven that babies can be delivered without the use of surgery and drugs if they're truly low-risk, healthy pregnancies. So as I've revealed that medical intervention is common, the reasons why is that our obstetricians and the nurses at the hospitals are not necessarily trained in strategies that promote a healthy progression of labor. They don't promote comfort for the family, for the men and the women, and they don't give options to natural birthing positions or comfortive measures like walking. Hospitals are not equipped with birthing tubs or balls or stools or benches, which help things go much more smoothly. These kinds of things reduce the need for drugs. And so what I want to offer to you today is that there are alternatives to hospitals, and while we kind of bridge the gap of this highly medicalized way of doing things to kind of balancing it out with more natural approaches. And midwives provide that. Midwives are trained professionals. They've been attending births since people have been being born. Currently in the United States, only 8% of births are attended by midwives, but in Europe, most healthy births are attended by midwives. And in other countries around the world, midwives are the first choice for a healthy pregnancy. They have more options. They'll be more patient with you as you're progressing through the long hours of labor. And there are nurse midwives, and there are certified midwives. They're highly trained. They can work in hospitals, in birthing centers, in your home. They have plans if you need to get to the hospital because there's some kind of an emergency. There is a plan and a protocol set in place to make sure that everything is going safely. And if you need to get to the hospital, you will get there well within the safe amount of time. So when that time comes